First, I'd like to thank our good friend and colleague Sergio Giannassini for the fabulous Vein Week, and also Pauline for this wonderful invitation to comment on the first MasterClass in Phlebology. I sincerely appreciate it, and I appreciate both of you so much. We're commenting about the pelvic leaking point and varicose veins of the ischiatic nerve by Dr. Ull. Dr. Ull demonstrates the anatomy with ultrasound of this particular case, and I believe the abnormal venous structures are quite well identified with ultrasound and allow quite safe access with a needle and foam sclerotherapy. There's an excellent review article by Dr. Ull regarding the anatomy and embryology of the small saphenous vein and the importance of identifying anatomical structures that may be at risk, including arteries and nerves. Of course, this is of paramount importance. Do no harm. So in this wonderful review article, there are some excellent demonstrations of the ease at which it is to identify nerves and critical structures on ultrasound. Ultrasound-guided foam sclerotherapy is the best option for this patient, in my opinion, and UGFS is usually the answer for most problems in our office. UGFS performed freehand with a 25 gauge needle would be my choice. For the less talented marksman, angiocatheter placement is an option. Tumescent anesthesia might also be considered and performed prior to injection via angiocatheter for those who may be concerned about the potential for extravasation of foam and resultant nerve injury, perhaps the perceived risk of DVT from the volume of foam that might be injected in a case like this, or perhaps tumescent anesthesia may help with post-treatment patient comfort, where theoretically tumescent anesthesia would limit the amount of blood or coagulum that would collect in the treated vein post foam sclerotherapy. Nerve damage due to needle advancement, in my experience, is quite rare as an interventional radiologist, where we advance needles all over the body. To put this into perspective, I'd like to share a story from my days as a resident trainee physician, where I was performing a challenging C1-2 puncture for a cervical myelogram, and the neurosurgery resident became frustrated at how slow I was moving and literally advanced a 21 gauge needle through the cervical spinal cord more than once. I was startled and very impressed that actually the patient suffered no harm from a needle going through his spinal cord multiple times. So injection into a nerve or the spinal cord, of course, is of concern and is a quite dangerous thing. However, in a peripheral nerve, a patient will, certainly an awake patient, will alert you when you're putting a needle through a peripheral nerve. They will complain of a shock or pain or move involuntarily, as most of us have experienced. Rarely I have found ultrasound-guided foam sclerotherapy, injection, or extravasation around a nerve to be of concern. I can recall a single case of a sensory nerve issue after foam sclerotherapy involving a saphenous nerve that was transient, and the patient did make full recovery. So that would be my opinion on this particular case. Thank you again so much, Sergio and Pauline, for the invitation to comment on this case.